Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Dermatologist.
Hello guys. The weather is changing and we might see a rise in the number of patients with acute asthma exacerbation. So let's discuss about this chronic disease, called asthma, today. Asthma is a chronic respiratory condition, characterized by inflammation of the airways. Let's discuss the key features of asthma. 1. Airway inflammation. The airways of individuals with asthma are sensitive and inflamed. This inflammation can be triggered by various factors, including allergens, irritants, respiratory infections, or physical exertion. 2. Bronchoconstriction. In response to the inflammation, the muscles surrounding the airways may tighten called bronchoconstriction, leading to further narrowing of the air passages. 3. Increased mucus production. The inflammation also stimulates the production of mucus, which can further obstruct the airways. The patient with asthma might have the following symptoms. 1. Shortness of breath, difficulty breathing or feeling out of breath. This can range from mild to severe. 2. Coughing, persistent cough, especially at night or early in the morning. The cough may be dry or produce mucus. 3. Chest tightness, a sensation of pressure or squeezing in the chest, accompanied by discomfort. 4. Increased respiratory rate, rapid breathing, especially during episodes of asthma exacerbation. 5. Wheezing, which is a whistling or squeaky sound when breathing, especially during exhaling. It is caused by the narrowing of the airways. It is important to note that these symptoms can be triggered or worsened by various factors, including 1. Allergens, such as pollen, dust mites, mold spores, pet dander. 2. Irritants, such as tobacco smoke, air pollution, strong odors, and fumes. 3. Respiratory infections, like the common cold or flu. 4. Exercise, exertional physical activity can induce symptoms in some individuals. 5. Weather changes, cold air or sudden temperature changes can trigger asthma symptoms. The management of asthma involves combination of medications, lifestyle adjustments, and monitoring to achieve and maintain control over symptoms. Regular monitoring of asthma symptoms and peak flow measurements helps individuals and healthcare providers assess asthma control. Peak flow meters are handheld devices that measure the airflow out of the lungs. By tracking peak flow values, individuals can detect changes in lung function and adjust their treatment plan accordingly. Then identifying and minimizing exposure to asthma triggers is crucial for managing the condition. This may involve avoiding allergens, controlling environmental factors, and taking preventive measures during respiratory infections. Lifestyle adjustments like maintaining a healthy lifestyle and habits are also important for overall asthma management, which includes regular exercise, a balanced diet, and adequate sleep. Regular and scheduled follow-up appointments with healthcare providers are essential to assess asthma control, adjust the treatment plan, and address any concerns or changes in symptoms. Patient education on asthma is a critical component of management. Patients should understand their medications, and how to use inhalers and devices correctly, and when to seek medical attention for worsening symptoms. Regarding asthma medications, the choice of medication depends on the severity of the asthma and the individual's response to treatment. The medications for asthma are divided in two broad categories, that is for long-term control and medications for quick relief. Medications for long-term control. These medications are taken daily to prevent and control inflammation in the airways. They include inhaled corticosteroids, leukotriene modifiers, long-acting beta agonists, and combination inhalers. Quick relief medications. These medications provide rapid relief of acute symptoms by relaxing the muscles around the airways. Short-acting beta agonists like albuterol, and anticholinergic like ipratropium bromide, are commonly used medications for quick relief during asthma attacks. Prevention. While asthma is a chronic condition with no cure, there are preventive measures and lifestyle changes that individuals can adopt to manage and reduce the risk of asthma symptoms. These measures include 1. Identifying and avoiding the triggers. As discussed earlier, patients should determine the specific triggers that worsen their asthma symptoms. It could include allergens or irritants, and take steps to minimize exposure. 2. Create a clean and healthy home environment. Regularly clean and dust your home, use mattress and pillow covers to reduce exposure to dust mites, and keep the home well ventilated. Consider using air purifiers if necessary. Carpets must be removed from home. If that is not possible, use vacuum cleaners on carpets rather than using broom to clean them. It is better to remove all pets, especially birds, cats and dogs, as these can trigger asthma. 3. Manage allergies. If patient notices that allergies contribute to asthma symptoms, work with healthcare providers to manage and treat allergies effectively. 4. Avoid tobacco smoke. Avoid exposure to tobacco smoke, both active and passive. Smoking is a significant risk factor for the development and exacerbation of asthma. 5. Maintain a healthy lifestyle. Adopt a healthy diet rich in fruits, vegetables, and whole grains. Consider regular light, physical activity as that can support overall respiratory health. 6. Vaccinations. Stay up to date on vaccinations, including the annual flu vaccine. Respiratory infections, such as the flu, can trigger asthma symptoms, so vaccination can help prevent such infections. 7. Manage stress. The stress can contribute to asthma symptoms. Thus, practicing stress management techniques such as deep breathing, meditation, or yoga to help reduce stress levels might help prevent asthma attacks. 8. Adhere to medication plans. Take prescribed long-term control medications as directed by healthcare providers, even when symptoms are not present. Consistent use of controller medications helps prevent inflammation and keep the airways open. 9. Regular checkups. Schedule regular checkups with healthcare providers to monitor asthma control and adjust the treatment plan as needed. 10. Patients should educate themselves. Learn about asthma, its triggers, and the proper use of medications. It must be noted that asthma symptoms can vary from person to person, and they can change over time. So, a close monitoring and follow-up is needed. It must also be noted that asthma management is also individualized, and what works for one person may not be suitable for another. Thus, self-medications must be avoided, as your case might be different than other patients with asthma. Hence, regular checkups and open communication with healthcare professionals are crucial for adjusting the treatment plan as needed, and maintaining optimal asthma control. If you have any questions or query, do leave us a comment.
Subscribe to my channel at YouTube at Gerdologist and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.